The expert. We are talking about skin cancer today. It's actually become the leading cause of death, cancer death, for women in their 20s.
Dr. Jennifer MacKinnon from the Medical College of Wisconsin joining us to talk about this afternoon. Let's start with the different varieties of skin cancer we need to know about.
Yes, there's basal cell carcinoma, which is the most common, and then squamous cell, and then melanoma, which is the most feared. And it is, thank goodness, the least common, but definitely it's present.
I was just reading, it's on the rise, the numbers, both for melanoma and those diagnosed with the other types of cancers you mentioned.
Right. The incidence in the U.S. is about 1.3 million people will have some type of skin cancer, and 80,000 will be newly diagnosed with melanoma. And then 10,000 of the 80,000 will die of melanoma.
I don't know if we have this, but you said those pictures that went viral earlier this week of the woman who said she tanned all of her life and then her face was just scarred from all the things that were removed. Here it is right here.
That's part of her treatment.
This is what they're warning you against, because they can find little bits that just need to be carved out of your body because they could be cancerous.
Right. It's disfiguring to have the basal cell and the squamous cell. Definitely, though, melanoma is on the rise because of this tanning bed use. Young girls that use tanning beds for this pre-prom tan or whatever, just one tanning bed session increases your lifetime risk of melanoma by 20%, and each additional is another 2%. And if you regularly use a tanning bed before the age of 35, your chance is 80% of having melanoma. So we're seeing a huge rise in tanning bed use.
Yeah, we're not getting the word out there enough to young folks. Let's talk about things on the skin, the A, B, C, D.
E. There's an E now too, isn't there?
There is an E. So A is for asymmetry. So if you were to imagine a line through the lesion, if it looks different on either side. B is the border, if it's notched or blurred or irregular. And then the C is color, if it has like a dark pigment that goes different than the other shade, if it's not uniform in color. The D is diameter, so greater than a pencil eraser head is a good marker to say maybe this is a dark mole that needs to be checked out. And then E if it's evolving over time, if it's changing.
Besides avoiding the sun and avoiding these tanning beds, what can you do to make sure you're reducing your risk?
Yes, sunscreen for sure, daily use. They even make it tinted for women for their face, and as long as SPF 15 and even 30 would be recommended.
Wear a hat.
Wear a hat. Clothes that have the SPF in them are great. There also was a recent study for chemo prevention, which is prevention of cancer of the skin, using vitamin B3 at a dose of 500 milligrams a day. And that study just came out of Australia and showed that it decreased your chance of non-melanoma skin cancers.
All right. All good advice. Got a question for any of our experts? Send an email to asktheexpert@tmj4.com or leave a voicemail. The number is right there on your screen. Thank you, Doctor. Coming up, we will show you